It's 5:30 p.m. on July 23rd, 2025. I will call to order the Town of Bourne Board of Health meeting for this evening. And so first order of business, well, this is a hybrid meeting. It is being broadcast on Zoom, and the chat will not be monitored. Participants who wish to speak must raise the hand icon until the chair asks them to unmute. Note this meeting is being televised and recorded by Bourne Community TV for replay. If anyone in the audience is also recording or videotaping, they need to acknowledge such at this time. All items within the meeting agenda are subject to deliberation and votes by the Board of Health. If anyone from the public wishes to access the meeting remotely, they can do so by clicking the Zoom link or by calling the following conference line on their phone and using the Zoom meeting ID and password below. The dial-in number is +1 309 205 3325. The meeting ID is 848-0862-6866, and the password is 897944. So, first order of business is attendance. Dusty Meyer?
Yes.
Miguel Prieto?
Here.
Okay. Margaret Reale?
Here.
Donald Ellis? Mr. Ellis is absent, and Bob Collette here. Okay, number 2, 101 Williams Ave. Sam Iamale. Sam, come to the podium, please. Announce yourself and let us know what you have.
All right. For the record, Sam Iamale with JC Engineering on behalf of the owners and applicants of 101 William Ave. This project here involves upgrading an existing failing septic system with a new Title V system utilizing IA technology. The work associated with this upgrade involves removing the existing septic tank to replace with a new septic tank with a microfast insert. We'll be utilizing the existing pump chamber and then removing and replacing the existing leaching field in the approximate same location that it is today. Due to the constraints of the site, we are requesting the following relief: a 5-foot waiver from the SAS to the front property line, a 13.7-foot waiver for the setback from the SAS to the foundation wall, a 1-foot waiver for the width of the strip out around the perimeter of the SAS, and lastly, a 88.4 variance for the setback from the SAS to Flax Pond. We also received conservation approval last week, and with that, I'd be happy to answer any questions the board has.
Okay, thank you. Does anybody have any questions for Mr. Iamale?
The existing nitrogen production is 15.75.
That's,
And
I
you're
believe, what we, I
reducing it down to
think it was a hair rope.
10.65 or 8.46?
9.18.
You got another figure that I don't have. What was that, 9 point something?
9.18 based off of the nitrogen loading calculation worksheet.
So that's quite a reduction. And you're doing a total strip out, I see here.
Correct, yes, up to 4 feet.
And geothermal,
Yep,
okay.
the geothermal membrane will be around that 4-foot strip out.
okay. That's it for me.
I have a general question, and it's just maybe if it's too complicated to answer at this point, that's fine. And I've just been meaning to ask it. How do you guys calculate the project's nitrogen load? How do you project that?
Yeah, so there's actually a worksheet that kind of, you just kind of plug and chug numbers, but
Is it
based
this
on
worksheet?
the area of
Oh.
the site. Yeah.
And somehow, through using this worksheet, you project. Okay, all right.
Yep.
It was created in conjunction with the Conservation Commission and Cape Cod Commission.
Okay. It's good. I have no questions.
Perfect.
Okay. And Miguel, any questions?
Yes, I actually have some questions and comments, and the question that I have based on the approval for the permit on the town application, does that apply to this or no?
The notice of intent?
Yes, because we received the notification that the requirement for the IA systems has been suspended.
So that requirement is strictly for the areas in the watersheds deemed determined to have a total daily load of nitrogen as determined by DEP. This area is subject to your own local regulation of the 150-foot setback regulation.
So that was my question.
Yep.
So that does not apply to this?
Nope, this location is not in one of those impaired watersheds.
Okay.
So this is that last little home right next to the little
Right
beach
before
there?
the beach there,
Yeah,
yep.
yeah, okay, to the right of it, yeah. Okay. And Caitlin, do you have any comments or anything to add to this?
Nope, just that, if you guys were gonna impose any conditions, I wanted to let you know that the two-bedroom design that they have already has a two-bedroom deed restriction recorded, as the previous system was already a two-bedroom system.
Okay. All right, any further questions? No?
No.
Okay, we'll entertain a motion.
I make a motion on 101 Wiggins Ave, from JC Engineering, on behalf of the owners, Richard Wood Bryant, requesting a relief from the Board of Health regulations for a proposed septic upgrade. The variances requested include a 5 feet waiver for the setback from the SAS to the front property line, 13.7 feet waiver from the setback from the SAS to the foundation wall, and a 1-foot waiver from the roof of the roof and replacement around the SAS, and the local variance requesting 88.4 foot setback from the SAS to the flat point to be approved. That's requested.
Okay, second?
Second.
Okay, all in favor, Margaret?
Yes.
Yes.
Aye.
Aye. Bob? Aye. Miguel? Aye. Yeah. Okay, thanks, Sam.
All right, thank you, guys.
Good evening. So next will be number 3, 22 Cajun Ave. Ongoing septic system violation for a discussion and possible vote on continued non-compliance at 22 Cajun Ave regarding a failed cesspool identified in 2018. Property owner has failed to comply with multiple orders to upgrade the system issued on February 20th, 2018, May 29th, 2018, and January 9th, 2020, under Title 5, 310 CMR 15.302. The original order required a good faith effort to correct within 30 days. Caitlin.
Yes, just a little background. On February 20th, 2018, the health department conducted an inspection of the system at 22 Cajun and noted that there was discharge of effluent to the surface of the ground through ponding and was deemed failed, and the owner was ordered to pump the system within 24 hours and repair within 30 days. On May 29th, 2018, there was no response, and a second notice was sent with the same orders. On January 9th, 2020, the department sent a notice of failure to the owner again and requested they call the office upon receipt of notice. The certified mail was signed for, but there's no documentation of that correspondence happening. Anne Marie and Stacy uncovered this past correspondence related to this violation while doing some general office work and started investigating to see if the repair was ever completed.
Wow.
We don't have any documentation that did happen, and pump out records indicate a cesspool and or a tank on the property were pumped out 3 times in 2022, 5 in 23, 4 times in 2024, and once this year in May. Based on this, we can confirm the system is still in failure. Per Title V, a septic tank or cesspool that requires pumping more than 4 times a year is a system that fails to protect public health and safety and the environment. So yeah, once we did confirm all this, Stacy sent a further notice alerting them of this and the public hearing.
What's our next step?
So you guys would discuss this and come up with an appropriate time frame for septic repair. So per Title V, you guys can order upgrades to be completed within the shorter period of time than specified in Title V. So typically with a failed system, they'd have 2 years to complete that. Obviously, at the time of this, it was noted that it was a safety, or not safety, environmental health hazards, so they were given 30 days versus 2 years to do good faith effort. So you guys can do a different timeline. If the board chose so, they could vote to issue fines or allow the health department to issue fines according to the Board of Health fine regulation at their discretion if you guys have an order tonight and that's not followed through on. So options that you guys can discuss today.
Have we
So
had,
Michelle,
Yeah.
I have a question. It seems to me that this is both an owner and a system failure. I mean, this happened in 2018, and here we are, like 7 years later discussing this.
Yes.
are we in contact at all with this owner?
I believe-
You've sent numerous.
Mute him,
Yeah.
he might have something to say.
Have
I
they
think
ever
he probably doesn't have it
responded?
on.
They were asked to come, right, tonight?
Yes. I don't. It's a phone, so I don't think I can unmute them. I can ask to unmute. but-
Yeah, I think you might have to ask.
Okay, and I'm always in favor of helping residents, but I think we're being too lenient here. And especially it's been a failed system for 7 years and nothing has been done.
Yes.
Congratulations on finding it.
I believe somebody called to do a pump out, and we're looking for the location of the system itself.
So, okay,
Yeah.
because I was going to say, how did this go on and on like this?
Well, the last notice went out with the last health agent, and that was
was
right
2020, right?
before
It was
COVID.
January.
So I'm
It was
assuming
Uh-huh.
the last notice
Yes.
went out, and then
Everything fell apart.
everything fell apart.
Right.
Just got-
Yeah.
So we should take some steps.
Mm-hmm.
Again, I'm sorry, I didn't hear the answer. Did you, it seems to me you asked the person to be here, right? Weren't they?
Yes, and I believe they are here on the phone. I just
Okay.
can't ask them to unmute because it's a phone.
She said *6,
All right.
so.
If you're here for 22 Cajun and you'd like to speak, if you hit *6, you can unmute your phone.
I did see someone's face.
Yeah.
I think there was somebody from town council.
So, I mean, you guys could come up with a timeline for, when at a deadline for a perk test, a deadline for a permit submission, and a deadline for completion tonight if you wanted to do that.
I think the deadline should be much less than 2 years,
Yeah.
I agree, yes.
because it's been way more than 2 years.
Would a 6-month deadline be too far out? I mean, I'm trying to think, to schedule, schedule an installer and
To find appropriate contractors to do such work, yes.
3 months or 6 months or,
Yeah, so I mean, the total completion could be 6 months, and you could have a shorter time frame to just start the good faith effort, so even find someone to schedule a perk test. Because that doesn't necessarily have to be the person who's doing your system or designing it. It could just be someone who's licensed to do that work.
right, and then I'm thinking we should probably mandate scheduled pumping service too, monthly or something like that. Does that make sense? Or,
Yeah, it should definitely be pumped on a regular basis right now. If it's not, the last one being in May, I would say we'd want to see it probably 3 to 4 times a year, so on like a quarterly basis.
Quarterly.
Yeah.
Sure.
Mhm.
okay, so at least, May, so then we would have to maybe have one done by August.
August.
Sometime in August.
Mhm.
And then, if we're going to go, I just put 6 months out there as a guess, but if you think it could possibly be done in shorter time than that,
It's possible that could be done in a shorter time, based off of what I've heard. The conversations my staff has had with the owner is they have not started this process at all. So getting in
That's
contact.
Hello?
He unmuted.
Hello.
oh,
Hi.
Hi, I've been trying to get to talk to you here.
Yeah, no worries.
I had to,
and it
I
could,
had it pumped last week.
Last
okay,
week.
could you identify yourself for the record, ma'am, please?
Yes, I'm Paul Johnson. I'm the
Oh,
owner.
sir, okay, sorry, thank you, sir. Okay,
I had it pumped in June, and I had it pumped 10 days ago, actually.
Wow.
okay,
And I've been correcting it with Riddick's, and right now it's not overflowing.
okay. But the fact that you've had to have it pumped each of the past 2 months is concerning.
Well, yeah,
Yeah.
I have a problem.
Right. And the problem doesn't go away typically, so it's there and it's just
Oh,
not,
no,
right.
This problem went away, but my problem, the thing is this, I don't have money for an upgrade. I told them that in 2018. I'm strictly on Social Security. How do you do that? How can I put out $40,000 for a system when I only take home $1,400 a month? And out of that, I gotta pay my taxes, I gotta pay heat. You name it. How do I do that? The only thing I can suggest is that the town put a lien on the house and do the septic system. That's the only thing I can think of.
Never seen that.
Yeah, that's not something that is typically done. We're not familiar with that process. I don't think it's been done. But the county has a septic loan program that you could look into where I think you
I
pay,
tried looking into that.
well, they would, go ahead.
Money.
Yeah, it still will cost you, but it would be at, I think, 1%, or sometimes 0% if you qualify. So it's a matter
Let
of,
me,
go ahead, and it's over a 20-year period.
oh, well, 20 years, I'll be 120 years old.
Okay.
That's status thing. I'm 90 years old now.
Okay, all right,
My life expectancy is much longer.
okay. I understand that part, but something needs to be done here to remedy this problem.
Well, if it doesn't overflow, there's no problem, right?
The ground's saturated.
Yeah. The ground, the effluent is saturating the ground every time it overflows. So that's the problem, and then that stuff, contaminates the groundwater eventually, and that's what we're here to avoid and put a stop to.
Okay. I don't have an answer for it, but, do whatever you wanna do. I mean.
You own the property, sir?
There's nothing I can do.
Right. You're the property owner, correct?
Yes, I am.
Okay.
So it-
Yeah, so ultimately, you're responsible for addressing the problem. And, the town can't come in and save the day on this. I would suggest that I think the best option for you is to approach the county, because that's where you're going to get the best deal. We understand that it's a really large expense for anybody who has to do this, and, but it does have to happen.
Oh,
Yeah, it's not something that you could just keep pumping or pouring chemicals into to try to take care of it, because that,
well, I've been doing for 7 years, is pumping it, on the average 4 times a year. Last year, I was lucky to get around with it, just 3 times. And this year, I've done it, let's see, 1, 2, 4 times already.
right, that's a lot, that's too much. It's definitely in failure. So,
I don't know what to do. The only other thing I could do is sell a house.
Sir, I'm not a financial advisor, but you could get a reverse mortgage and pay for this, but this may.
I have a reverse.
Well,
I have a reverse mortgage.
well, then you need to talk to someone that is a financial advisor on how to address it, but this has to be addressed.
Okay.
yeah. So we're going to set some timelines for you, and you need to adhere to those. So you'll have to consult with with financial
Okay,
manager.
I have a question.
Sure.
If I don't adhere to them, what are you gonna do?
Well, we could fine you over and over again until the problem is solved. We don't want to have to do that, but that's one of the options that we have available to us.
Finding for a person who doesn't have any money. That's not good.
Well, it's not something that we wish to do, but
Okay.
if you choose to ignore any orders that we might put forth this
The thing
evening.
is, I'm not ignoring it. I'm trying to work something out. But I'm beating my head against a stone wall.
Okay. I think, you know, as Dr. Prieto suggested, your best option, it sounds like your best option is to consult with, you know, whoever it is that you work with, the financial manager or consultant, and then see how you might be able to come up with the financing to do this. And again, Barnstable County would probably give you a 0% loan for 20 years. And if you're talking, if it's $30,000 to fix that, then, you know, it's only $1,500 a year. So, you know, a little over $100 a month, you could probably take care of this. 120, 125, whatever it comes out to.
Okay?
All right, I know that, I know for someone who's on
How do I,
Social Security, that's a lot.
how do I go in that? I'm
You,
housebound, I don't have wheels, I can't go anywhere, I haven't been out of the house in 7 months except to the emergency room.
You have a telephone, though, so if you call the county, then they'll be able to guide you as far as how much they could lend to you and so forth. And then what they do is, they would probably put a lien on your house, you know, if you didn't pay it. But I'm not sure how it works for them, but I think that's the way that does work. And
Right.
so, but again, the town wouldn't be able to do something like that, and this is a problem that absolutely needs to be addressed.
Okay, I understand.
Yeah. And I understand your predicament too, sir, but this is something, you know, we can offer you these ideas and resources, but you have to follow through on them, okay?
Okay.
All right. Any questions or other comments from board members?
No,
Okay. Board?
I'll, I think I'm done.
Set up a.
Okay.
I think, you know, what you were suggesting is setting up, not just saying get it all done in 6 months, but set up like, okay, in 2 or 3 months, get the perk test done, you know, like, you know, and check in and make sure that gets accomplished, you know, each step, right? There has to, rather than just having the whole thing done. How about the Council on Aging? Would they help with, I don't know, guide him? Do they have any kind of financial guidance to help him make connections?
I don't know if they specifically have one, but their outreach coordinator could probably connect one.
I'm just wondering, you
Yeah.
know, if he, on his own, if it was difficult to.
Yeah.
Yep.
If we could involve them, that would be nice.
So that's a suggestion, just to call up
Can
there,
reach
see if
out to
if
them.
someone there could help him in securing the loan.
I was gonna mention that they do offer financial advice. It's not necessarily services, so you could consult with them. The thing is, if we come to a determination that this is in violation, he already has a reverse mortgage, they may just, you know, close on it. He might lose the property anyways. So it is in his best interest to find a solution to this issue.
Let me explain the reverse mortgage is, it's maxed out. It's been maxed out for 10 years. I don't have any equity left in it at all.
Excuse me.
Okay. I will-
You still there?
Yeah?
Yep.
No, we're still here. We understand your predicament here, but you know, this is damaging the environment, and it is, our mandate as elected officials to make sure that this does not happen.
I understand that.
We understand your situation, but we just cannot make exceptions, and, this needs to be addressed.
What I'm saying is that if I can prevent it from overflowing, shouldn't that be enough?
No, it's not enough, according to the laws, and we do not make the laws. The laws say that's not enough. That needs to be addressed.
Okay.
I don't know how much it costs to pump.
At least $500 each time.
Actually, it costs
it,
$50 every time I have it pumped.
50 is not bad at all.
because a pay,
It is.
because of the payment on a loan, you know, a monthly payment on a loan, I would hope that they would gauge that payment according to your Social Security income, I hope. And you're paying a lot out, having it pumped. And maybe the payment on the loan would maybe equal what you're paying out to have it pumped all the time.
That'd be all right.
Right. It's something you would have to discuss with,
Yeah,
you know.
you are paying out to have it pumped out.
Right.
So it's an expense for you.
Yeah. And it's just gonna get more expensive the longer you put it off, the whole
I
thing.
know that.
Yeah,
I know, it already has.
yeah. Okay.
When it first started out, it was only $99 a pump it. Now it went to $199, then it went to $270, and then it jumped to $350.
Right.
That's $1,200 a year.
Yeah.
Yeah, so
I know.
that's about what, you know, slightly less than what you'd be paying for replacing your system through the loan that you would get with the county.
Okay, so,
You know, and that's just roughly, you know, they're doing rough math in my head, but I don't know how, and of course not knowing exactly how much a new system would cost you. So, you know, you're better off having that done. You don't have this problem hanging over your head, and the payments, financially, it's gonna cost you very similar amounts, sir.
Okay.
Yeah.
Okay.
You know, I can understand not wanting to do it, but I'd say you have to bite the
I'll
bullet
go
on
with
this
that.
one. Okay,
so,
all right.
so step one is the perk test.
Mm-hmm.
And then,
He's silent. He's speaking, his mouth is
Oh,
moving.
he's talking to someone else.
but-
You're fine.
Yeah.
Mm-hmm.
okay, so what's the next step?
Then we would need a permit application submitted to the office.
Okay,
And then the next step would be system installation and inspection.
so, let's look at, step one, perk test. What's a reasonable amount of time for that? I know he's to secure a loan probably first,
Yeah.
but,
Although the loan wouldn't actually, did they wait until there's an approved plan? I think they don't actually release the funds until there's a plan under
okay,
review.
okay.
So, a perk test could be scheduled within 1 to 2 months.
Okay, so, you want to say how many, I just say, let's say, 1 or 2, you know, what do you think, 1 or 2 months, and say to get the perk test done?
They're booked that far out, the engineers?
For us, they're booked out at least 2 weeks right now. But yeah, depending on the engineer's availability, and then actually contacting one and contracting one to do the work.
Yeah.
So a
Couple months.
2-3 month leeway. Mm-hmm.
Okay, you want to say 3 months then? 3 months,
From today?
yeah,
7 years, I mean,
get the perk test done.
yeah.
So I have a question for the chair, though.
Sure.
Can we, when we make a proposal in which we have two contingencies to be met, one is the good faith effort to be done within
Right,
30 days, that we have evidence of that, and then the time to completion, whatever time you decide, whether 3 or 6 months to complete it. But both milestones have to be met. We have to have the good faith effort within 30 days.
Yeah.
If that's not met, that triggers the next step.
right, yeah, absolutely. I think there has to be established timelines for each step.
So, the good faith effort within 30 days could just be that the perk test
Scheduling it?
application is submitted to our office.
Okay,
Yeah.
I agree.
okay. So what, you said the perk test application is submitted to your office, okay. And that's to be done in 30 days, that sounds good.
Yeah.
I think that's a good idea to break it down
Mm-hmm.
into steps, okay. Application,
How do I get these applications?
We
To
can
apply?
we can definitely give you a call and walk you through those steps. And we can also, if you have we can send a list with phone numbers of soil evaluators, and then that person could actually fill out the application for you. You wouldn't have to.
Oh, okay,
Yep. So we can provide you with that.
okay, thank you.
Mm-hmm.
Can you provide him with an outline of everything? You know,
Yes, absolutely.
1, 2,
Mhm.
3, 4, what to do? Okay.
Yep.
Stepwise, yeah. And also connect him with Council on Aging.
Council on Aging and the phone number for
Yeah.
the loan program with
Loan
the county
program,
as well.
right.
Mm-hmm.
Okay.
Okay. So do you want to just stop there and say the good faith effort? And also, Miguel, were you suggesting having it completed in 6 months to put that into our motion right now?
That's what I will put that on as,
A contractor and engineer can't come up, I don't believe, in that short a time frame.
Okay.
I know what
No.
it takes once we're notified,
Okay.
how long it takes. So I think the first step would be to have the perk test, which will give you the guidelines, or us the guidelines, how long it'll be before the work is done. So, like you say, it's a step by
Okay.
step by step.
All right. So we've got the 30 days for a good faith effort that he gets the application submitted. Do you think that that's the first step, and we're going to have to come back and do it again, you know, each,
I mean, you could also put down,
or completing the perk test?
you know, you could do, instead of it be like the full completion, if say we have 30 days to submit the perk test application, from there, it doesn't take much to design a conventional system for that type of lot. And at that point, he would most likely have a relationship with an engineer who would be doing that work. So you could put permit application submitted to our office within 3 months of that deadline, so 3 months after those 30 days. And then, you know, if any of these conditions aren't met, then we come back for either an extension or further enforcement.
Okay.
And
Sounds good?
Yeah, and then so 2 years is our typical time frame for a failure. Obviously, we want to be a little bit more
Stringent.
stringent with this one. So, I mean, you could make it 6 months, you could make it 1 year, and again, if we get to a time where he thinks it's not going to happen, or his engineer thinks it's not going to happen in that timeline, we can always come back and extend that. But putting it on as a time frame so that way we're all sticking to it might be good.
And should
I
we
think
also,
that, yeah, the
Go-
motion has to be specific and time-bound.
right, and should we also mandate a pumping schedule? Or is that,
I would recommend him continuing to pump. I don't think necessarily, is it just you living in the house?
No, there's 5 other people in the house.
Okay, then yeah, maybe a monthly pumping might still be necessary, yeah.
monthly pumping?
Yeah.
Yeah, with, you know, notification to you.
Yeah.
Some sort of a record to the office,
Yeah.
okay?
Is that it?
Okay. We're working out that.
They're working on their motion.
Okay.
Oh, okay.
So help us to get this motion here together. So good faith effort in 30 days, which means application submitted,
The perk test application, yep.
perk test application.
And then
I'll do that as soon as possible.
a permit application submitted. I don't know if you feel comfortable with within 3 months after those 30 days.
The permit application within 3 months. Okay.
And then I would say a system installation and inspection within 6 months.
What, did you think 6 months was too soon, Dusty?
Pardon?
Did you think 6 months was too soon? Yeah, you said you didn't think they could get
Well,
it?
once the perk test is done, then that gauges how many companies are super busy, who's willing to bid, and that will give you that. So once he gets that and puts the word out, you know, notifies these different companies, that will tell us how long it'll take.
Okay.
I mean, I've seen the company I work for, go out the following week because the person is in dire needs, but you don't know. You don't know.
This would be one of those things that's considered an emergency repair, and those
Correct.
do happen in a quick turnaround.
Let's face it, the soil is saturated, and that's the reason why he's pumping so much.
Yeah.
So, Dustin, you say 6 months from after having all the paperwork done at the 3-month mark, that will make it 9 months, is not realistic, or it is?
Can I interject one thing? I say,
Sure.
get the perk test, then come back to us with some information. In other words,
So yeah,
that we can set a time limit from that point on. But until that perk is done, and an engineer or a certified installer says what they're gonna do, if it's a regular Title V, that's down
it
and
will be a
dirty.
regular Title V.
Well, after the strip out, haul in and everything else,
Yeah.
because who knows how deep that is.
That's true. But I don't think that it would limit it, the type of system, the type of work that would be done wouldn't limit the number of installers. I think there'd be plenty of people that could take that job on.
Because it's a regular Title
Yeah.
V, down and dirty, and here we go. Yeah,
Yeah.
I'm used to that. I've seen that many times. But until you get a perk test, no contractor's gonna be able to give you, or us, then we can set a proper timeline.
I mean, we can gauge too. I mean, we've done 4 properties in that area recently, and they've all had full strip outs, but they're all conventional systems with the loading rate of less than
We figure
5,
on a
at least.
Yeah, so I
regular
mean,
Title V,
this is going to be
2.5
your
days.
basic system just with a
Yeah,
full strip out.
2.5 days in and
Yeah.
out.
Mm-hmm.
So,
with that information, do you think that 6
well,
months might
set
be
the
okay?
30 days then as a goal.
For the perk test, or for,
Okay.
Right,
Right.
for the perk
But you're still
test.
suggesting that
And
we not
then-
set a 6-month timeline for the completion? Wait till after the perk test, and have them come back? That you want to move that?
Yeah, so we hear from everyone that
Okay.
it's still moving
Go
forward.
ahead and, you can move that, make that motion.
Would you need that to happen then if all the pieces fell into place just on their own before that happened? So say the perk test gets done in the next 30 days and then we get a submission from an engineer within 10 days after that, do you need to see this person before you again, or are you satisfied that they're doing the work?
I would say that I'd be satisfied that they're doing the work if the
Yeah.
engineers are submitting plans, yeah.
So if we do a good faith effort within 30 days and an anticipated deadline of completion within 9 months, and if milestones are not being met, then the health director will schedule another board hearing.
Correct, because I
Yeah.
don't believe you have to come back before, him, come back before us if it's a regular Title V and everything's
There,
clean.
yeah, there shouldn't be any issues.
That's an in-office
Yeah.
situation.
Okay,
I can try.
all right, go
And then
Margaret.
to include like a pumping schedule
Yeah,
until that
pumping
completion date.
Say monthly.
Oh, yes. Yes, 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 that's true. And
Well, we have a
we're
book
suggesting
there,
monthly.
presume.
Monthly.
um,
Yeah.
Okay. And this is, so I move that 22 Cajun Avenue, that we are going to ask, number one, a good faith effort by submitting an application to the Board of Health or to the Health Director for a perk test to be done in 30 days. That a permit application within 3 months. That we're projecting system completion in 9 months. If these milestones are not being met, we'll have to reconvene and decide what we're going to do from there. we also are ordering a monthly pumps of this system, of this, whatever, cesspool.
Oh,
Yes, hello?
oh, I just wondered if he's still there.
Okay, right, we're in the middle of a vote, sir. But
Oh, okay.
before we go ahead and vote, I'd just like to ask you, if you have 5 other people in the house, are they all paying you rent?
No, they do not.
Oh,
Okay, well, maybe it's time for some folks to start helping you out a little bit with things. I don't know what the situation is, but, you know, they're all
Well,
contributing.
I only got 2 people working.
Okay.
One's a part-time job.
All right, well, they're all contributing to the situation, so,
Yeah,
then maybe they could help fix it, okay?
yeah.
Just a thought, and I would recommend that you discuss that with them. Okay, so, we have a motion on the table, do we have a second?
second,
Okay, all in favor? Miguel?
Hold on, I
Okay.
want to make a change to that motion, because the motion, the way that it sounded, maybe Ms. Shea can correct me, it sounds like it could get away just by doing monthly bumps if those other things are not met. Is that correct based on that wording?
She, Margaret also included that if milestones are not being met at those timeframes, we'll reconvene and assess if next steps.
We have the authority to start fining if those steps are not met, but those are the recommended timelines that Caitlin
Yeah.
is in agreement with and had suggested relative to when the perk test should be completed, and also on the information that could potentially take another 6 months or so for the project to be completed. So if we set the timelines and those are not met, or there's been no good faith effort, then we can decide on how to move forward with enforcement, which would include presumably fines.
So yeah, with the way that it's worded is, so say after 3 months, we haven't actually received the permit application. So the project didn't have to be completed, but we hadn't met that milestone, is that we could potentially reconvene and assess further steps that we would take.
Okay, I vote aye then, based on the clarification.
Okay. Dusty?
second,
Okay. Margaret, obviously, and Bob, aye. Yes.
All right, Mr. Johnson, we will reach out to you either tomorrow or Friday, and pass on all that information that we talked about, okay?
Thank you,
No problem. You have a good night.
Okay, thank you, sir.
thank you. Okay,
Okay,
night.
good night. Yep. I would also add, just as an afterthought here, when you speak with the Council on Aging, maybe they could
Bridge the
assess
gap
the
a little bit,
situation,
yeah.
bridge the gap, and see what the situation is there at the home where other people there are contributing to the problem, obviously, so,
Yeah.
you know,
To help
he
him.
should be getting some help. That was a good thought, Dusty.
no, and
Yeah.
they have a bus that they transport people around, and if he could get a loan from Barnstable, they
Yeah.
could give him a ride, arrange a ride.
Yeah, right.
You know, and I'm just gonna say this for the record, this is borderline elderly abuse. If he's 90 and they're not
Yeah.
helping him,
Yeah.
it will require,
That,
you know,
That's a
to
good
be
point.
reported welfare services as well.
that's my concern too, Miguel. That's why I'd like them to kind of just assess what the situation is there, because that concerns me a lot too.
Sounds like they're taking
Yeah,
complete
taking advantage of this guy.
advantage of
Yeah.
the situation,
Yeah.
and I'd like to see the inside.
5 other people living there, and 2 of them work part-time.
Mm-hmm.
What's going on? And not even helping him, so.
Absolutely.
Okay. Next item is number 4, 5E Blockview Drive. Non-compliance with orders to correct dated April 25th, 2025 and June 24th, 2025. Violations of the State Sanitary Code 105 CMR 410.000. Discussion and possible vote on declaring property unfit for human habitation. Okay. So, Caitlin, anything to summarize? We have sent
yeah,
us lots
so-
of great information on this.
The water issue first came to us in April of this year, so around April 8th. We were notified by the Buzzards Bay Water District that water had been curtailed for non-payment. A letter was sent to the owner of record by regular and certified mail, letting them know that the lack of water is a condition deemed to endanger or materially impair health or safety and is required to be restored within 24 hours of service of the letter, and was asked to call discuss the matter with us as soon as they could. Certified mail at that time was returned as unclaimed or unable to forward. On June 24th, we received a complaint that there was no bathroom or working sink in the unit, and Health Inspector Wills visited the property that day. Did not make contact with any of the occupants, but left a second notice at the door letting them know water service must be restored. On the 26th of June, Buzzards Bay Water District received a call from the occupant inquiring about the outstanding balance, and according to the Water District, water still hadn't been restored that day. On July 2nd, Buzzards Bay Water District reported partial payment made by the occupant, and that service would be restored once the balance was paid. On the 7th, water service was fully restored after full payment, but the technician had to turn off the water valve inside the building due to extensive leaking pipes in the basement onto a heating system, but was posing a potential hazard. On the July 16th, notice was sent to the owners that the property remains without required supply of water, notice of the hearing before the Board of Health, and notice that the board could potentially vote to find the property unfit for human habitation with orders to vacate. This notice also included notice of additional violations of the state sanitary code and Board of Health blight regulations. As of today at 9:30, no plumbing permits had been pulled to rectify the leaks noted by the Buzzards Bay Water District.
Okay. Thank you. Dion, did you have anything to add to that?
That's pretty much it. I mean, I've not been able to get inside of the home.
Right.
The first time there, I knocked, no one answered. I managed to get a contact number for the occupant. I've called and left a couple of messages and no call back, and they have yet to call the office. So what Caitlin explained is the way it is.
Okay. All right, thank you. Appreciate it. Okay, any questions, comments?
This auction?
Hmm.
Yeah.
Go ahead, Margaret.
I just have one question about the ownership. We have the document saying that the auction was May 29th, 2025? What is that? How does that
Yeah,
fit in?
there was some confusion about that between the owner of the property and the owner of record is the person who is addressed on all of these notices,
Yeah.
James Laurie.
Yeah.
At some point, there was a lack of dues paid for the homeowners association, and the association had sent notice that they were going to take the property. There's no record that we could find that happened, but there was an auction of the property. Still couldn't find any legal documentation.
No new
that
ownership, so
happened,
we're
yeah.
assuming that this man is the
Um,
owner.
Yes. He is who is living there, and he is who is on all the documents that we could find listed to this property.
Okay,
Is anybody on from,
yeah.
on Zoom from this property? Okay.
Okay, may I say something?
Sure.
So I'm just gonna try to summarize this. This is a violation for non-payment to the water district, right? And the owner has been contacted multiple times and multiple efforts have been made to correct the situation. There has been no response from the owner, even though he was notified. Is that correct, Michelle?
So, yes, kind of. The violation is lack of water, whether or not that's for non-payment or not. The payments were finally made, but there were leaks, so they could not fully turn the water back on. The leaks needed to be repaired, and there has been no good faith effort to repair that at this time in the last 20 or so days.
So the violation right now is not lack of payment, but there needs to be
Water.
For repairs to be done, correct?
Yes.
And there's also the garbage, which is another.
Yes.
They went in and they reported that a lot of garbage was inside, when they went in to fix the water, right? Or to,
Yes.
to turn on the water?
The technician reported the interior of the home is filled with piles of garbage and has a strong, unpleasant odor.
Right.
Again, that's from their report. We have not been able to verify such. So
So what is the time frame from the time that the payments were made and the other issues that came up? And was the owner notified of those? Did we legally notify him of those violations?
of which violations?
Well, the ones that are keeping the water from being reconnected.
So
If it is not lack of payment.
yeah, the violation isn't lack of payment and it's not leak. The violation is there is no water. So it doesn't matter what is causing that. The health code violation is that there is no running water at the property.
And I'm just trying to determine that we're supposed to give him, the opportunity to, rectify the situation. So if we don't know what's causing it, how are we gonna have to rectify it? So if it is lack of payment, if it is, the repairs need to be done, repairs.
Yep.
We just need to be specific on the motion. If both issues have been met, and the owner is not doing anything, then I think the house should not be inhabited.
Right.
Yeah, so with water service, it's 24 hours to show good faith effort to restore water. So the 24-hour notice, the first time for lack of payment was back in April, and then secondary notices in June, and then the 24-hour notice for the, service is being turned off again for the leak was on July 16th. So that 24 hours was July 17th, and we have not heard anything.
Was the owner notified of this meeting that we're having this item on the agenda today?
Yes. He was served by a constable.
Okay. Well, I'm ready to make a motion.
Okay. Go ahead.
So I make a motion for 5E Bourne Drive to be declared not safe for habitation. People can come in to rectify issues, but they are not allowed to stay there until the issues are rectified.
Okay.
I second it.
Further discussion.
Go ahead.
Yeah. further
There
discussion.
is a draft order written by town council,
Right.
which is similar to a project that we had done before. I don't know if that's something you guys want to include in your motion as what the
That's this-
orders are including.
That's this final decision and orders document?
Yes.
Okay. Would somebody like
Did
to?
you get that? I didn't see that. I
Okay.
apologize.
It's a document that was included in our packet. It's called Final Decision and Orders, 5E Bogview Drive, just Buzzards Bay.
Let me check that.
It's actually 3.5 pages of specific findings and, conclusions of the law and the orders. If anybody,
So we want to accept that,
well,
or we'll discuss whether we want to accept. In other words, this is going to be the order if we so move.
this would be,
The
yeah,
legal order.
this would be the legal, it's
I've
a,
got it here someplace, I did
On
read this.
page 2, there is a highlighted section from numbers 14 to 17 that would just need to be modified as of
Right.
today.
'Cause this was written beforehand.
Yep, so just to include anything that would changed from the time of writing this.
I had read it over and,
this has the,
yeah, over here. Right,
okay,
Yeah.
yeah, it's just a
is that
different
rather right
format.
thing, right? It's just small.
Yeah, okay, same thing then.
And, I, looks good to me. I mean, I'm not a lawyer. It looks, I mean, I thought, we got this all written up.
Yeah.
Here,
Ethan
these are-
from town council is on if you had any questions you wanted to ask him as well.
Okay, so these are the orders down here.
Yeah.
In the last
Those are all the,
page, the bottom of page
Yes,
3 and the
okay.
top of page 4. Here we
Okay.
go. Orders.
yeah. I'm gonna tell Miguel that, I know he's reading through the whole thing.
Okay.
All right, I read the whole document, my motion stands.
Okay. Do we have to say something in the
You could-
motion?
you could-
To say,
You could amend the motion to include all of the orders as written in the final decision and orders drafted by town council.
Miguel, do you want to do that? Did you hear it?
Yeah, so that we have to specify what the issues were, I agree with that.
Yeah.
I think that's better. So shall I reword the motion? So make a motion to discard the previous motion, everybody agrees?
Okay.
Yes.
Aye.
Okay.
Margaret?
Okay.
Aye.
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 Dusty? Aye. Okay.
So make a motion on 5E Park View on, declaring the unit not safe for human habitation until water service is restored and the violations on the sanitary code for the, removal of, what would you call that, waste products that, jeopardize human health are removed from the premises.
Okay, would you want to include the orders
Yeah.
at the bottom of page 3 and the top of page 4 as,
Part of the motion.
So it could just, the motion could just be to accept the final decision and orders drafted by town council and amended this evening. And-
So, I just have a question, this might just be semantics.
Yeah.
When you say something is condemned, usually a condemned building is deemed to be destroyed. We're not wanting to destroy the unit, we just wanna declare it not fit for human habitation until these issues are corrected. But if it is the same meaning, then I'll just read verbatim.
Excuse me.
Sure, go
I have
ahead.
a small thing to add. I have been inside the house, I live next door, or I own the house next door. And I was recently inside the house, and there is no bathroom sink, there's no shower, and the toilet does not flush. And so there's really unsafe conditions for health concerns related to that. Not able to flush the toilet, they're eliminating themselves in bags.
yeah.
And there's just a lot of different people going in and out of the property constantly.
Ma'am, I'm sorry, may you identify yourself for the board?
All right, Sandra Cadell.
Thank you. All right, so I would strongly recommend that we specifically include the orders that have been drafted by town council to be included in this motion.
and we will use these orders, right? These orders will be presented.
Yeah, so this would be sent to
The-
the homeowner, and it would be, serve as an exhibit in any posted minutes as well.
So the motion should be amended to say that we are going to, we agree with and include these orders, and they shall be what we will use as our statement to the,
I will reformulate the motion to
Go ahead.
include that, I
Okay.
think that's important. So,
Excuse me, Mr. Chair.
Yes,
This is Ethan Dively with Town Council's office. One of the concerns I expressed to staff was just that the final version of this decision be updated with respect to paragraphs 15, 16, and 17, which are highlighted
okay,
in that draft. I've just now sent the director a new copy by email, which proposes to, represent in paragraph 15 that 4 of the 5 board members were present tonight for the hearing.
yeah,
We're not.
That made a clarification in paragraph 16 that staff has confirmed that no plumbing permits have been pulled. And then in paragraph 17 simply stated that Mr. Laurie did not appear to provide testimony at the hearing. I think with those proposed changes, this decision could be voted tonight and issued.
okay, gotcha.
okay. Thank you.
So yeah, Dr. Prieto, the motion could include that the board accepts the final decision orders drafted by town council and amended this evening. And that would cover your motion as well.
Okay. So do I need to read them, or what you said is enough?
I think what I said is plenty enough for you.
Okay.
Do we need a second?
So you need to second it and vote, yes.
Okay, so he doesn't need to restate the,
So, Dr. Prieto could say so moved, and then
Okay.
a second could happen.
and say so moved, Miguel?
Yes, move.
So moved. Okay,
Second?
second.
And then a
Okay.
roll call vote.
Margaret Reale.
Yes.
Okay, Bob Gillette, yes. Okay. So, done with that, thank you. I appreciate it, and so that property is hereby condemned.
Sounds like it needed to be.
And the actions regarding this vote will commence tomorrow, right? We'll be notified.
We want to make a correction. 5 members are not present on yours.
Yeah.
He did.
So they gotta change
He
it.
did already.
He did.
He was?
Yeah. Okay. So, all set with that. Thank you. Brings us to number 5 on the agenda. Any public comment on non-agenda items? Nobody
see
from
any.
nobody from the public on non-agenda items. Okay. Number 6, Health Director's Report.
All right, yes. So starting off, we have the Charter Review Committee is looking for volunteers. The town is inviting residents to apply for appointment to the Charter Review Committee. This committee is charged with evaluating and recommending updates for the town's charter, which defines how Bourne's local government operates. I provided you with documentation about the review committee and how to apply if you want to take part. If you would like further information, you could go to the town website's Charter Review Committee page. But they ask that we share this with all of our local board members as they are already a part of the governmental function
Yeah.
of the town.
What is it, every 5 years or something?
Every 5 years, yeah.
Yeah. I remember last time, so maybe, if anybody else is interested, I might step into that. You know?
Right.
Yeah. If anybody, we can go in force if anyone else wants to.
No.
All right, thank you, Caitlin.
Yeah. And then another little update I wanted to give you guys is that the select board's notice of intent was accepted by Mass DEP on July 17th, which has resulted in suspension of the requirement for existing septic systems within those defined watersheds to upgrade to best available nitrogen-reducing technology by 2030. And also has also suspended the new construction requirements for banner technology at this time. They're suspended while the town works on their watershed permit application, which must be submitted to DEP by July 7th of 2030.
Yeah, I think that'll make a lot of people happy, huh?
Mm-hmm.
Yeah. So, and it does, it does a little stress relief for a lot of folks, I think. Okay.
So, hold on.
Yeah, go ahead.
Are we allowed to discuss this now, Ms. Shea, or no?
The
I
regulations.
know you email each one of us individually, and
Yep.
then we reply to you, but I have no idea what my colleagues think or what their opinion is, and I could learn from that, and, I will tell you exactly what I think too.
So I have notated the people who have responded, all of your comments and concerns, and so the next time we post the public hearing, we'll discuss them and kind of go from there. So I've made drafts based off of recommendations from board members that submitted their comments, and I'll present all of those changes to you. So we'll be looking, it has to be noticed for 2 weeks in the newspaper, so we're probably looking for end of August, early September, the next time we would hear the regulations.
Okay. All right. Anybody else? No? Number 7, any comments from the board regarding future agenda items?
Yes.
Okay, Margaret has some.
I was talking with Caitlin, and I'm going to read something she mentioned. She said, if the board wants a tour of the Mass TC, which is the Massachusetts Alternative Septic System Test Center, which is out on, I guess everybody knows,
Oh, yeah.
out on Joint Base Cape Cod. I'd be interested in going. Maybe nobody else needs to. Maybe everyone else has been there and knows everything. So it may not need to be a board thing. But I'm just going to say, can just one person go? And
Oh, absolutely, yeah. I mean,
and if other people want to go,
I've been planning on going. In fact, I have Brian's name on my contact, like, call Brian, because I wanted to get out there and do that, too. It's
So,
really fascinating.
Caitlin
place.
had mentioned it could be if a quorum wanted to go, we could make it a meeting.
yeah, it would just be we just post it that you're attending this, and so there's no quorum issues, but you could all go and learn
Yeah,
and
I'm
ask
definitely,
questions.
I'd be interested, yeah.
And it doesn't have to be a quorum, right? We
No,
could
it doesn't
just
have to be,
several.
no.
But, so we're just mentioning it, that's something I should do.
I can, yeah, if you guys have, well, I'll reach out to them first to see if they want us, like at what time of the year they're looking to have people come out.
Okay,
And then I'll shoot some dates and times, then we can kind of go from there.
okay.
Yeah, great. Okay, do we have minutes to approve here? No minutes to approve.
We did not receive any yet,
I
no.
didn't think so. Okay, so number 8, approval of minutes.
Hold on. I
Oh,
have a-
oh,
I haven't had a chance to talk.
oh, sorry, go ahead.
Yeah, that's okay. I just want to say, when we see items on the agenda like today, that as a board, we're not to make emotional decisions. We have to do them by the law. And, always people give excuses, but, like, it is not our position to make excuses based on specific circumstances. We have to go by what the law says. And I found that today's item, it was just borderline there on the emotional thing, and we have to be careful.
Right. Right, we have to follow specific laws and regulations around everything.
Yes.
Okay, well, thank you, Miguel. So we'll entertain a motion to adjourn.
I make a
Are we
motion.
going to approve the minutes?
We've got none.
We have none, right,
I'll make a motion to adjourn.
I'll
okay.
second it.
Dusty second. Miguel?
Aye.
Aye. Bob? Aye. Thank you. Interesting meeting.